Hello, and thanks for joining us for this special live edition of Being Well. I'm your host, Lori Banks. Tonight, we're going to be taking this hour to talk to you about an issue that affects so many, directly or indirectly, and that is depression. We have a phone number that you can call tonight with your questions for our operators. It's 1-877-727-9348. Our operators will take your questions and then they'll send them over to me. So you won't be live on the air if that was a concern for you. I want to introduce our panel of guests. We've teamed up with Sarah Bush Lincoln Health System for our program tonight. And joining me is psychiatrist Dr. Jeremy Yost and licensed clinical social workers Jennifer Ogle and Richard McDade. Thank you all for coming in and talking about this topic.
Thanks for having us.
All right, we're going to get things started. And Dr. Yost, I want you to begin with talking to us about what exactly is depression.
That's a good question. Depression is a sustained change in mood for usually at least 2 weeks. Over the last couple of weeks, the person will feel down or hopeless. They may not have joy in anything they do. Energy can be low, sleep could be up or down. They may have more or less activity, but they just don't feel themselves. And nothing seems to change that.
All right, so at what point should someone say, geez, this doesn't feel like me, maybe I need to go talk to my primary care?
Also a good question. Many people, I've met a lot of people that in talking to them, I say, do you think you might be depressed? And they'll say, well, I don't think so. And I say, well, you're not sleeping and your energy's low and you can't concentrate and you're starting to think about suicide occasionally. And so then, oh yeah. So sometimes it requires family or friends to kind of help people see that they're feeling that down. Otherwise, many people know when they're depressed. So I say if you have any issues with mood or sleep or energy, concentration, it's time to think about depression.
All right. Jennifer and Richard, I want to turn this over to you. You're a licensed clinical social worker, so you talk to people a lot. You see a lot of people in our area. How common is it?
I would say at least half of our practice of patients that we see experience some form of depression, whether that's clinical depression or situational depression.
All right. So you brought up a really good term that we often hear, clinical depression. What is clinical depression?
Clinical depression is a set of criteria that people have to meet, and I think Dr. Yost would be better able to answer what those criteria are.
So what are the criteria? Because I know there's sort of a list. It's a little bit complicated, so I want you to simplify it first. How do medical people such as yourself diagnose clinical depression?
Well, so I think the easiest way to think about it is we all get down sometimes,
right,
especially if we're depressed. In general terms in psychiatry, that's an adjustment disorder. But if it's just dragging on for weeks and weeks, even after there's no stress, then you got to think about, well, could it be clinical depression? So clinical depression has specific criteria, like for the last 2 weeks, one must have depressed mood, sleep problems, interest. It's a list of basically 9 criteria. And one has to meet 5 out of 9 for the last 2 weeks. That's clinical.
Okay. Can people be not clinically depressed?
Yeah, so there's a range. There's dysthymic disorder, which in med school we all joked that, oh, we all have dysthymic disorder because it's low-level depression every day for at least the last 2 years. So, and then there's adjustment disorder, like if a divorce is happening or you lose a family member, then that would be more of a bereavement or an adjustment disorder.
So what's kind of how does it work if you think, well, I'm kind of sort of having these issues? Do you go to the ER? Do you try and make an appointment with a psychiatrist? What do you do? What's sort of the course of action?
There's a lot of different ways that people who are feeling depressed can present for help. They can go to the emergency room, they can call their primary care doctor, they can call and ask to be seen by a psychiatrist, they can call and ask to be seen by a counselor for talk therapy. Many times it's they're recognizing it or their family members are bringing it to their attention and then they seek help.
All right. We want to remind you tonight that our program is live, and if you would like to call in with questions for any of our guests, you can call that number. It's right on the screen. It's 1-877 727-9348. And I want to mention, very importantly, if you are in crisis right now, you can always contact the Regional Behavioral Health Line. They actually have counselors standing by right now that can take your call. If you are having thoughts of suicide, extreme depression, we want to give out that phone number. It's 1-866-567-2400. That is the Regional Behavioral Health Network crisis line. So if you're in crisis right now, we encourage you to call that number. If you have a question about depression, maybe it's for you or a loved one, we'd love to hear from you right now. Our operators are waiting to take your call. I want to turn a question over to Richard. When we were talking about this program, you said one of the issues with depression is it's actually subjective in nature. And that can be, I don't know if the word is problematic. You know, if you have high blood pressure, you have a number that says it's high.
Right.
What about depression? It doesn't have a certain, you either are or you aren't.
Right. And you know what? I spend a lot of time trying to quantify. And, you know, medical doctors many times, when someone comes in complaining of pains, they'll say, well, okay, not only what kind of pain it is, but on a scale of 1 to 10, 10 being the worst, where do you think your pain is? And depression, you can do the same thing, you know. And I spend a lot of time, because I'm usually at the end of what you were talking about. How do you get here? Well, generally people are referred to me by the doctors, including Dr. Yost, but also general practitioners. And so one of the first things I do is get into the causes of depression, and to me they're internal. There's a chemical imbalance, so to speak, and then there's in the environment where, you know, there's a lot of things out there that happen to us, and it's depressing. It could be short term, could be long term, you know. So I spend initially a lot of times normalizing moods, you know, because depression, we all have that to a degree, day in and day out, you know.
So it is normal to feel sad.
Yeah.
So at what point, if you had to be a little more objective, at what point does the sadness become beyond? I don't like using the word normal or abnormal, but when does the sadness become something that you really need to see somebody
Well,
about?
the way I would answer that is when it becomes debilitating.
Okay.
In other words, you can't seem to get things done. You're irritable. You can't get along with your spouse or your children, or the anger, the irritability is flowing downhill, and so you take it out on the people often closest to you.
When you said irritability, you don't think of that as being a sign of depression. You think, I just can't get out of bed. But irritability, why does depression make people irritable?
Well, they deal with the stress, which creates some depression, and then they can become frustrated because it isn't always a simple solution. So they become more impatient, which then turns into irritability, you know.
Okay.
And I got to be careful of my vernacular, but we do. We get frustrated with ourselves, and that's when it's even worse.
Okay. We have our first question from a viewer. This is from Bob in Mattoon. And Dr. Yost, I think this one might be for you. Bob asks, what is the difference between depression and depression with bipolar?
Oh, that's a good question. So, in general, major depressive disorder is considered unipolar, one pole. The person is depressed. Whereas with bipolar affective disorder, the person is mostly going to be depressed, but every so often they will stop sleeping and they start talking very fast and they're thinking 1,000 thoughts at a time, and that's mania. So bipolar affective disorder involves manic episodes intermixed with depression.
Okay. How is the treatment different for someone with just depression versus someone with depression with bipolar?
Yes, it is.
Okay.
Quite a bit different.
All right, so can you kind of run us through a little bit of what are some of is it different medications, different therapy options?
Well, first off, medications and therapy always go hand in hand. Most science shows that therapy is extremely important with the meds. Just meds alone is often not as effective. So with depression, you have a range of antidepressants and then things you can try to make them stronger with. Whereas with bipolar, it's kind of like the antidepressant med puts something underneath to lift the person up, but you also need a lid on the top, which would be a mood stabilizer or antipsychotic medication with the antidepressant.
All right, we have another question, and I think either one of you could answer. This is another person from Mattoon. This is John, and he asks, how much of a role does alcohol play in depression, and is it important to give up alcohol if you are depressed? And we know that alcohol is a depressant, so I would think that might work against you if you have depression.
Yeah, I think it plays a big role in that. So oftentimes people are feeling down and feeling depressed and may turn to alcohol to numb themselves, and then it sends them even further into a depression, and then they increase their alcohol use to numb themselves even more. So it plays into it highly.
How does alcohol, if someone is on medication for depression, how does alcohol maybe interact with the medication that they're on? Dr. Yost, you're a medication guy.
It interacts badly.
Yes.
So alcohol is something like 60 to 70% comorbid with depression, which means there's a high rate of people who are going to be depressed who drink and a high rate of people who drink who will be depressed. They kind of go hand in hand a lot. So the alcohol is such a sedative to your electronic systems in your brain that it almost generally overwhelms any antidepressant medication.
So what about for someone who may be taking other substances like that increases their, it's the reverse of alcohol, uppers.
Stimulants.
Stimulants, thank you.
Yeah.
What effect do stimulants have on depression? You'd think, oh, I just take a little more stimulant to
Yeah,
pick
so
myself up.
generally stimulants will make anyone feel better for a little while, but eventually your brain cannot keep up with making the neurochemicals you need, which will lead to more depression. Plus, the stimulants are hard on your heart and blood vessels, leading to early heart attacks and all that.
All right, I have another question for you. I'm going to put you on the spot again.
Okay.
In the brain, Richard talked about how depression can be internal and external. So he talked about brain chemicals. What's going on in a depressed person's brain that's different than a non-depressed person's brain?
Well, that is a good question. So first we should qualify this by saying nobody knows.
Okay.
So there are a wide variety of opinions. There are psychiatrists that do not agree with what is called the serotonin syndrome or serotonin theory of depression, which is that, in certain parts of a person's brain they have lower serotonin, so they're more depressed. But I think the brain's way more complex than that. But what we're taught in med school is that basically within the limbic system, the central parts of your brain where your emotions are, you supposedly have lower serotonin than average if you're depressed. But that's probably, I don't know, that's an extremely infantile characterization of something that's very complex.
All right. Well, we'd need charts and graphs to
Yeah.
get in. So we won't dwell too much upon that right now. But I kind of wanted to give people a sense of maybe some of what is going on.
Well, let me add
Okay.
something there because I think this is important. As far as I'm concerned, if a patient says, may I drink alcohol with my medications? To me, the answer is no,
Okay.
absolutely. And I remind a lot of people that alcohol is basically a depressant. So it doesn't make much sense taking an antidepressant and washing it down with a depressant.
So if someone says, well, it's a fancy dinner, can I have 1 glass of wine? Is that, what's your recommendation? I can tell by the look on your face.
It would be mine, I
Okay.
would say, But on the other hand, common sense, a beer or a mixed drink or a glass of wine is acceptable, but some people
Don't know how to
don't
quit
stop.
at one.
Yeah, they don't know to stop.
I want to turn this next topic over to you, to really any of you, but I'm guessing you guys see talk about a lot of misconceptions and myths about depression. What are some of the common things that some of your patients bring to the session that is just not quite right on track, or misconceptions that they may have about what's going on with them?
I guess to get that started, I think a lot of people are under a misconception that it's easily controlled. And many of them come in thinking that all needs to happen is Dr. Yost or his fellow psychiatrists. All they have to do is give us some medicine. I don't have to change any of my behaviors. I can drink or whatever, and so that's a simple answer. It's not a simple answer. It's can be very complicated. So,
Jennifer, what about you? What are some of the misconceptions that maybe even family members of people who have depression may have about it?
That it's not as severe as what people want to believe it is. It is a very severe condition, can be a very severe condition. And I think in regards to family members and misconceptions, that I think they don't believe and don't support their family member and how severe it can be and the type of help that they need.
So that whole snap out of it, get over it, pull yourself up. I got through this without, I lost my spouse and I was fine.
Right.
We're all different. Everyone
Right.
handles stress and things differently.
Right.
So how do you help people kind of move beyond that? It's, just something you can't just get over.
Well, I think it goes back to normalizing that everybody experiences depression at some point in time in their life, and everybody responds to depression differently, and it's going to depend on a lot of multiple factors, what their coping skills are, what their support systems are, and how to help family members understand that. It's just going to be a lot of reminding that, this is who I am, this is what I'm dealing with, and this is what I need from you.
Are people, I suppose by the time they get to you, do they know, are they pretty aware that they have depression, or do you see some patients that are in a little bit of denial that I don't want to be here, I'm here because my wife is making me go?
It's both.
Uh-huh.
It's both. There's some people that acknowledge that they're just not feeling like they feel like they should, and then there's some that are there because they're being mandated in some way.
yeah.
Richard, you brought up the medication issue. So is everyone who's diagnosed with depression put on medication?
Not necessarily.
Okay.
I have a good percent of people that when they come in to see me, they don't want to see a psychiatrist. They don't want to be on medication. Some people are afraid that when you start taking heavy medications, they're going to be sedated, they can't function, they lose their sex drive and all that kind of stuff. They don't want to mess with that. So a fair number of people, when they come in for therapy, they are serious about, hey, I want to do something like this, instead of going to my GP or wherever.
Okay, I want to get back to medication and therapy in just a minute, but we want to answer a question from Jim from Casey, who says, how do the shorter winter days affect depression? Do you see more patients this time of the year than other times of the year?
Yep.
They're all.
Yeah. We humans have neurons in our eyes that don't carry visual information. The wires go to a pineal gland that regulates melatonin and tells you, if you should be sleeping and tired or not. So when it's dark out all the time, a lot of people feel very sluggish. I do. They have light box therapy that people can try for that. It's something to Google if people are interested, I suppose.
Okay, so it does. It's actually a real thing. It's not just in our head.
Well, and when it's cold outside, people don't want to get outside and do anything because it's too cold, and they may be limited on what they can do inside to keep their bodies moving, and the more they move, the more energy they're going to have, and it's going to decrease their depression.
All right.
Well, and then we come up with phrases and words, but one that's very common now is SAD, capitalized, SAD, and it's an affective disorder, which means their mood is down. And so a lot of people from about middle November to Christmas time, sad is a frequent complaint, partly because of the weather, but the stress and missing family that are no longer around, So, but I read a research finding many years ago that this time of year, if you split the country in half, from east to west, the northern half has a lot more depression this time of year than the southern half. And it kind of goes hand in hand with what Dr. Yost is talking about. They just get a lot of sunshine down there that we don't
have
get,
it. Yeah, certainly not right now.
And I was in the military and stationed in Europe. And when you fly from the United States to Europe, you might leave sunny Chicago, but if you look out the window, we start running into more and more clouds the closer, and they're all headed east to Europe. So you can see why people are more depressed there, because it's...
I want to talk a little more about time of year. Do holidays, before Christmas, after Christmas, do you see more patients around the holiday time?
Yeah. There are some people that just get overly stressed with holidays. Like Mr. McDade said, missing family members that are no longer present, or if they live away from their family and can't get back home, there's definitely more of, I believe, an increase of people.
So certainly weather affects our...
And a couple of phrases that are popular: cabin fever and post-Christmas blues. So it's that kind of thing.
I'm from Minnesota. We talk about cabin fever all the time. that was a big... I want to get back to a little more talking about therapy and medication. So you said not everybody is going to be on medication. Does everybody go through therapy? I'll bring this question up. When does medication come into play? When do you decide the therapy alone is not really going to work by itself?
For me, it's when I've met with a patient for a significant period of time, 3 to 6 months, and we're working various forms of therapy and not seeing significant changes in their symptoms. Then that's when I'm going to recommend a referral to a psychiatrist.
Okay. We'll come back to this again, but we really want to get to your questions, and we've got another one here. Deborah from Charleston asks, how do you get a spouse or a friend to seek help when they don't want to and you know that they're depressed? So you have a friend that they're depressed. How do you bring this up, especially if maybe they're not keen on talking about it? How should the friend approach that?
Not beating around the bush and just coming at it with, I'm very concerned. Here's what I've noticed. These are the changes that I've noticed. I'm very concerned about your well-being and your quality of life, and can I see about getting you help? What can I do to help you?
We had a guest on another Being Well show, a professor here at Eastern, and she made a very good point. She said sometimes the depressed person is the last person to realize that they have depression. Have you found that same thing to be true?
Yeah, because I think with some people who are depressed, they've lived that way for so long that just becomes their new normal, and so they're not recognizing that they may be feeling more down until other people point it out to them.
I suppose you may run that risk of the friend or maybe your spouse not being real happy with you for bringing it up.
Oh, yeah.
Any advice for how to get through that?
Well, I think when you talk about suicide, it's such a sad statistic. And so when you as a therapist, are talking to these people, we all ask that question, and that is, are you feeling suicidal, homicidal? And many times that makes that scale from 1 to 10 go very high when somebody says, yeah, I've had some thoughts, maybe fleeting thoughts, but still thoughts. And so when a spouse or friend comes in and talks about their friend or spouse, and they mention, hey, I think they've been talking about suicide, then many times, we kind of develop a plan. It's not manipulative. It's just a plan to get them in. And I've offered many times to call the spouse directly and ask them to come in and see me.
All right. This question just came in as we're talking about suicide. Steve from Effingham asks, how do you know when a person is serious about suicide? You hear them saying, I just want to die. Do you as a friend take this seriously? I mean, we all kind of sometimes say, oh, I'm just dying over here. We say it as a joking mood, but if you're around someone that says, how do you know if they're serious? And what should you do?
Well, I think you've got to be aware of a pattern of behavior.
Okay.
If they say it once and you've not ever heard them say anything like that before and you don't continue to hear them talk like that, you can express your concern at their statement. But if you've noticed a pattern of behavior, including any of the depression symptoms on top of statements like that, then you share your concern and offer them resources.
Okay. Before we move on, is there anything else you want to talk about? Because we've had two questions now, people being concerned about how should they bring this up if they have a friend who's depressed. Any other things that you wanted to add to that before we move on?
Well,
Advice?
if you have any doubts, check it out, okay? Because so many times we post-suicide, you have all these people coming out of the works and saying, well, I wondered about that, or I remember him saying this, or she said that. So, no matter whether they're a friend that you love as a friend or a family member that you love as a family member, you don't want to be in the future saying, oh, I wish I had said something. Yeah.
It's better to take that risk of them being mad at you than...
And don't be afraid to ask, because so many times people feel that way and are just waiting for somebody to ask, are you okay? What can I do to help?
Also, if they get mad at you for asking, they'll get over it. But if they commit suicide, they never will get over it.
That's a very good point.
So,
before we move on, I want to bring up, there are counselors who are ready to take your calls from the Regional Behavior Hotline. If you are in crisis right now, you are having suicidal thoughts, you need someone to talk to, we would encourage you to call that phone number, and it's right there on the screen. It's 1-866-567-2400. That is a staffed 24/7 line, and it covers several counties here in our viewing area. They will call and get you the referral services that you need. But right now, if you have a question for our panelists, the number is 1-877-727-9348. And we've had some questions come in, and we want to thank you for that. We had an email question earlier, and this kind of goes along just with what I said. Diane emailed earlier in the week, and she says, if my loved one has depression, are there any free services or organizations available out there to help me with him? What do we have in our region or in our area?
well, I think these guys are probably better at answering about the total regional services, but in general, we can say the mental health system in this country is not so good right now, so there aren't that many free services. That's my impression. You have this crisis line, our BHN crisis line, which is extremely important to have that kind of service. Otherwise, you're probably looking at a community mental health clinic such as LifeLinks.
Mm-hmm. And LifeLinks, we should clarify, LifeLinks, they're actually the people that service the hotline, but it covers more than just Coles County, correct?
Yes, they're a community mental health center. They serve Coles County residents. I don't believe they offer free services, but they have sliding scale fees and treat people with insurance and Medicaid. I believe they cover just Coles County for outpatient mental health, but their crisis line covers, I think, 7 counties.
I think it's important to note that this is more important than money. So if someone has doubt, it doesn't matter. Go to the ER, come to the psych clinic, call the psych clinic, call LifeLinks, call ART, do something.
do something.
Yeah, we'll figure out the money later. And most places have a sliding scale, all the way down to 0.
Or a financial assistance
Or
program.
financial assistance program. So money should not be a factor in this. Unfortunately, it is in our culture, but it should not be.
Yeah. All right, I want to get back to medication. We all know that there's lots of medications out there. We'll pass this over to Dr. Hughes. How do you decide what should someone be on? And maybe if someone has been on a medication for a while, should they maybe think about changing it if it's not really working well for them? Are there other choices?
Oh, that's a bunch of questions.
That's a lot of questions.
So I think probably a good place to start is, regardless of what the antidepressant is, you're supposed to give it an adequate trial at an adequate dose. An adequate trial is 1 month.
Okay.
And an adequate dose varies on what the medication is. So basically, you have to get up to a high enough dose that it's going to do something, and then stay on it for a month to know if it's going to help or not. These are not pills that work within a few hours. Although some people do feel different within a couple days. According to the scientific literature, to know if it's going to work or not, it would be about a month at least.
Okay. So at what point do you have your patients, Richard and Jennifer, that say, I'm not happy with my meds, it's bringing me too down, or it's not working enough? How should they bring that up to their healthcare provider?
If they've mentioned something like that in a counseling session with me, I always recommend that they talk to the treating physician, whether that's a psychiatrist or their primary care doctor. If they don't feel comfortable bringing that up, I offer to make that phone call for them, as long as they will sign a release of information giving me permission to do that.
Okay. We had a call just come in. As Lori from Arcola said, this is interesting. A family member had a heart attack, and her cardiologist suggested that she take an antidepressant. Why would a heart attack bring on depression? You ever heard that?
It's very common.
Okay.
Actually, any kind of physical illness is highly associated with depression, but even our culture, we have the idiom of a broken heart, which describes depression. So many of the strongest people I know went on to have heart attacks and cardiac bypass, and they were depressed and took antidepressants. So I assume it's so common, so commonly goes hand in hand, that's why.
So
And it also
go
goes hand in hand with somebody that's had a stroke, right?
Oh, stroke for sure.
Changes the personality,
So is it a combination of physically what happened to them and then just emotionally that maybe you had this kind of near-death experience?
Well, and a heart attack can be debilitating and life-changing. Maybe they can't go back to work, or they have physical limitations after their heart attack or stroke, and that can cause depression just in those life changes.
Okay, very interesting. So sounds like if it's something, it's pretty common for that to happen. I know my dad had some open heart surgery, and they asked him the same thing, because his recovery took a long time, and it eventually turned around, but for some people, it's a big deal. We had another question come in. They said, how do you deal with family members who don't see the depression as an illness, as a problem? We talked about this a little bit earlier. Maybe it's a spouse that says, oh, I don't have depression, what's your problem?
I personally would tell the person that I was working with that came to me with that question, let's focus on you. And all you can do is continue to share with your loved one how you're feeling and how you're being impacted by it. Their understanding is on them. It's up to them to decide to support you and to do more research or to come to a better understanding. But I always encourage the people, let's focus on you.
Okay. Don't worry about it's for right now.
I don't want to say don't worry, because that's a worry, but I really just try to redirect back to what can we do for you.
All right. I want to talk to our two counselors on the set because you do that's what you do. You talk to people. You're a therapist. So I've heard people say, well, I really don't know what some stranger is going to tell me that is going to make me feel better about myself and what's going on in my life. How does therapy work? How do you deal with it? How do you start?
Well, I think initially you want to establish a therapeutic relationship. However, the therapist, does that. That's a unique kind of thing. But you know, especially adolescents, you make friends with them, you know, and then the second or third session, you become a little more probing and pushing some buttons, and it's amazing how many people will come in for the first time and, well, I don't know what to talk about. Well, once you get them talking, they talk and talk and talk, and then as a therapist, you can pick out some of their subjects, some of the things they say, and what they could indicate, and so it's a learning process too.
How long do these therapy sessions last, the session itself, and then for how long does it go on?
Most therapy sessions last no longer than an hour. In regards to how long over the course of time that therapy can go on, really varies on the person and what difficulty they're coming to you with, and how willing they are to work on making changes.
So you may be talking about things. Is just the talking about it helping the person, or what are some? I'd imagine you're trying to give them some coping skills and some skills. So what are you doing in those therapy sessions?
Well, it does start with building a relationship and helping them feel comfortable and at ease. And I feel like a lot of people come to counseling, they just need somebody that's listening to them, that they have their undivided attention, they're not being judged on what it is that they're saying or dealing with. And then as you build that relationship and support them, you're also offering, you know, feedback on suggestions of things that they can try.
Okay. I want to, I'll let you go.
No,
go
no.
ahead. Okay. Well, because this question fits in it. William from Champaign says he's gone to therapy and his therapist has suggested journaling. He doesn't think it's helping. What good does journaling do? Because William's saying, well, my therapist said I should do it. I'm doing it, but it's not really doing much for me. What do you think about journaling?
Well, I suggest that. I don't call it journaling. You know, it can be writing, you know, and but I use that a lot with PTSD, post-traumatic stress disorder. When people are grieving for whatever reason, I encourage them to write their thoughts down, because when you think about it, how many of us have driven, you know, from here to Champaign, and we get to thinking about things, and we think about our problems and other people's problems, and we really come up with some neat ideas, but by the time we get to Champaign or come back, we've forgotten them, you know? And a lot of people that are depressed and they dwell on their problems, they actually do come up with some good ideas, but they keep it to themselves, you know? And so when you start writing your thoughts down, they suddenly go from an inanimate object that you can't read, hold, feel, look at, to an animate object. It's there in black and white, you know? And also, it's a way of being cathartic or venting, and we need to do that.
Absolutely.
And you'd be amazed how many adults I challenge. You can't get 5 pounds in a 4-pound bag, and that's what a lot of human beings do. Then they start having psychophysiological problems: headaches, chest pains, nausea, diarrhea, irritability, insomnia, and it just goes on. And I've had many, many patients tell me, you know, I have all those. You know?
Do you have any, William, do you have any tips for how to, you know, write his stuff down to make it maybe a little more effective for him? You know, is it just maybe a few phrases, you know, a little every day, or what do you suggest?
When I advise people to journal, it's usually for multiple purposes. I'm hoping that they'll find something that has triggered them to feel a certain way, that they can find patterns to what situations are occurring or what their behaviors are, and that they can, with those patterns, find ways that they can move forward on their own. So in regards to journaling, I always encourage people, if there's a specific situation or event that you're journaling about, journal about what was happening immediately before that occurred, and an hour before that occurred, and the day before that occurred, to see if there's any patterns to that.
Okay. And I would think sometimes it's helpful, maybe if you've progressed and you've gotten better, to maybe, is it helpful to look
back
and go, wow, I have.
Right.
When you feel like I've gone nowhere, you can actually
You
look
can
back.
reflect back on your progress.
So is that something you prescribe to your patients?
Not every single one of them, but
Okay.
yeah.
Okay, good question. Here's a question I wrote down on here, and because I think this came out of our discussion we had before the show, was about help you help yourself. If you take a pill, is it going to just go away and you don't have to do anything? What do people need to do if they want to get through their depression? They've got to put a little bit of effort. It can't all be on the pill and on the three of you or the medical providers.
Right. Like Dr. Yost was saying, that research has shown that the best form of treatment for depression is medications and counseling in combination. And so they need to be able to, number one, follow the prescribed medication regimen as prescribed. But the number two, recommendations that are made to them in counseling, they actually need to apply those skills that we're attempting to teach them.
So what are some of the skills that in counseling that you're having people apply and work on?
Mm-hmm.
Can you give us an example without giving away someone's case?
Well, in regards to just generic skills, like teaching them better coping skills, walking away rather than just exploding, relaxation, meditation, reflective listening skills, those type of skills that they can apply hands-on.
Okay.
Well, and to add to that, when people come in because they're having marital problems, that's one of the things we do. We introduce techniques that are simple as possible and have them use those because it increases their communication between their spouse, And so we talk about the levels of communication, and instead of, just getting in a verbal fight, I suggest there's steps. The first one is a discussion, and sometimes the discussion goes to a disagreement, and the disagreement will escalate to an argument. Those three levels of communication are okay. Mm-hmm. They're normal, they're natural. It's only when it's going from an argument to a verbal fight. Mm-hmm. That's when couples say things that they shouldn't be saying, threatening divorce, whatever. And that's when we teach them a timeout. Mm-hmm. Whatever a timeout they want it to be, So that's what you're doing, and you're preventing depression from getting worse, because it's more of a external factor there.
Okay. I want to address a question that came in. Victoria from Charleston asks, and we talked about this before the show, it seems that more people are depressed nowadays than in the past. Is the rate of depression increasing? Dr.
Yes, it
Yost?
is.
It
Yes,
is?
I believe depression is going up. Yes, I haven't read the latest statistics, but the numbers keep creeping up.
And why? What are your thoughts on it, Jennifer?
I'm not sure
Okay.
that it's getting any worse. It's been there. I think people are becoming more open. Mm-hmm. And it's kind of like child abuse. I used to work for DCFS and in child abuse, and people were alarmed how much child abuse there was. It's always been there. Mm-hmm. We just never reported it.
Yeah.
We didn't have mandated reports, okay? Same thing with depression. I think, again, that's where you have to try and normalize it, And therefore, there's techniques, there's medications. You better communicate with your support system and so on and so on.
Do you think people now, because more people are being more vocal and open about it, that people are less ashamed? Is there still a shame factor to having depression?
There's still a stigma.
Okay. But do you see more people being more open about it? Do you think that's helping?
Oh, yeah.
Okay. We had another question come in. Someone asked, what are some of the common side effects of antidepressants? Dr. Yost, this one's for you.
Well, the most common side effects would be stomach upset and sexual dysfunction. Those are the most common.
Does that sexual dysfunction sometimes keep people from wanting to take antidepressants?
Oh, it's the number one reason people stop taking them and don't tell the doctor.
Okay. We had another question come in from Scott from Mattoon. He says, what do you think of natural or herbal supplements to treat depression? Are there some out there?
There are some. The issue is the doses are not very regulated, so if you take pill from company A and pill from company B, who knows how much is in there and who knows what else is in there
Okay.
is the issue. I mean, I'm not saying that I'm the biggest fan of the FDA in the world, but at least there's somebody somewhere watching who's putting what into the pills and trying to standardize it.
Are there some supplements, herbal supplements or natural supplements that someone could take that might interact in a negative way with their medications?
Absolutely.
Okay. So what's your...
Gotta be very careful with herbal supplements, and they generally need to be cleared by the psychiatrist and the medical doctor, because they can do things like change how the enzymes in your liver destroy your blood pressure medication. So it can make your blood pressure medication 10 times stronger or 10 times weaker, things like that.
Okay, so be careful of what you're taking and make sure you tell your doctor about all this. What about if someone, I want to talk to you a little more about medication, they just say, you know what, I can't take the side effects, I'm not taking it anymore. What happens if the pill took a month to start being effective in your system? What happens when you just quit taking it altogether?
So that's an important point. One should never cold turkey psychiatric medications, especially antidepressants. It can lead to worsening depression and suicidal thoughts. So generally, you need to taper off these medications slowly, like let somebody help you. So if my patients say, you know, I want to try to do this without medicines, I try to talk to them about what are the alternatives, what are the likely risks, and then help them taper off.
Okay. What about, I've seen ads on TV where they say depression hurts, like there's a physical, pain associated, muscular pain. What's causing that for people with depression, that physical pain, in addition to the emotional pain?
Well, in simplest terms, there's a lot of electronic frequencies and cycles going on in your brain, so you kind of have a pain threshold, like, if like your clothing's touching you right now, but you don't notice, you don't feel pain, you're not even processing it. Well, depression alters the electronic frequencies in your sensory cortex such that things that weren't as painful before are suddenly enough to basically break the threshold where you experience pain. So yes, pain is worse. Like joints hurt worse, headaches are worse, everything is more painful.
It's not just something that's in
No,
their
they can
head.
measure it with electronics, EEGs.
Okay. I wanted to ask, can depression be turned around? Can you get rid of it?
Well, you don't really get rid of it,
Okay.
but you can surely contain it
Okay.
by changing your lifestyle and consumption of drugs, following what the doctor says about medications, and we as therapists, that's pretty common, that we check how they feel about their medications, the patients, and we encourage them to take the medications as directed, because Dr. Yost puts that in his notes and he tells people that, and I reinforce that you don't quit your medicines cold turkey, and I've had people say, well, I'm going out this Friday night, we're going to be doing some drinking, so is it okay if I don't take my antidepressant medication today? And I said, no, it doesn't work that way.
So do people get down when they think of the fact that this is something they're going to have to live with for the rest of their lives?
They can, but whether they continue on a medication regimen or try to taper off and learn skills, it can be managed.
I think it's important to consider what's the difference between a cure and being healed.
Okay.
So, depression is such a complex set of symptoms, and who knows what's going on or why, that I don't want to ever give anybody the suggestion that they can never heal or that they will never be fixed or that they're broken. I think of it more like we're all working to get better and to heal and to feel as good as we can, and we can't see the future.
It's not like you break your arm and it heals and it's fine. But I like the way you said that. That's a really, as we're wrapping up here, I think that's a good thought to leave us with. Someone just asked, and we've talked about this, can depression cause you to have sleep problems? Too much? What do you see more of, too much sleep or not enough sleep, or a combination of both?
It depends. It's just like eating. It can also cause eating. So if I get stressed, I eat more. Some people get stressed, they eat less. So if I get stressed, I sleep more. Some people can't sleep when they're stressed or depressed.
So, but are sleeping problems, if you're having consistent sleep problems, should you say, oh, it must be depression?
No, but
Okay.
it definitely needs to be looked into. There's a number of sleep apnea, obstructive sleep apnea, which can damage your heart and lungs over time if it's not treated. Obstructive sleep apnea can also cause depression. So if you're not sleeping well, you should look into it.
Okay.
Go see the doctor and try to figure out why.
Yeah, because that lack of sleep can just lead to so many other
Oh, yeah.
things. Does the sleep, if someone has depression, poor sleep has an adverse effect on their depression as well?
Yeah.
Yes.
Okay. Someone had also asked us earlier in the day, if you take antidepressants, maybe you take one pill a day, is it better to take them at morning or night? Is there a difference?
Oh, good question. Well, some antidepressants make people sleepy. Like
Okay.
Other ones are known to make them more energetic. So generally I say, if it makes you feel peppy, take it in the morning. And if it makes you tired, take it at night.
Okay. So it's just however your own body
Yeah,
feels.
but like I say, Remeron, Trazodone, these are medicines that will make people sleepy. So generally, you wouldn't want to take that in the morning.
Okay.
And that's
okay.
something that we as therapists reinforce, that talk with Dr. Yost or Dr. whomever and clear it with them. And but we encourage people, well, if it's making you feel sedated early in the morning when you go to work, then talk to Dr. Yost about taking it at bedtime.
Likewise with sexual side effects, there are things we can do to try to fix that, or at least make it not as big a problem.
And you really have to be your own best advocate. If you don't tell your doctor what symptoms you're having and how your medication is impacting you, they can't help you.
Okay. This is a good question. I was actually thinking this too. Nathan from Newman asks, how does diet affect depression? Will eating certain foods make depression worse?
Definitely. I mean, so the better the person's diet is, probably the better they're going to feel. But definitely a lot of fat and sugars and stuff that are not, that are highly processed will make your mood worse.
Okay. So good diet. What about the role of exercise?
It's extremely important.
Okay.
Every time you exercise, it releases chemicals that stay in your body for days and stimulate your mood.
And there's been lots of research there by sports medicine field. And one of the sports medicine doctors that worked with marathon runners, and he wrote a book, Runner's High, because he determined just working around them how much more upbeat and energetic they were. And so, yeah, there's some concrete evidence that exercise.
Also, depression is inactivity. So if a person can force themselves to get up and go for a run, that's going to help quite a bit. It's very important.
Well, and just sometimes forcing yourself to get up and do something. And, maybe if you're at the gym, you're going to interact with people, which, may make you feel a little bit better too.
Yeah.
And if you're active, you're not focusing on your difficulties so much.
That's true. That's true. We've got just a few minutes left. Carol has emailed. She's seeking, Carol from Mattoon, if she is seeking any advice, a book or something that she could read. Do you have any good reads on depression or any that off the top of your head that you think are good to talk about depression, good books out there?
I don't have a specific depression book, but I think a good book is Mind Over Mood for kind of helping people understand how thoughts and feelings interact. And the author is Greenberger.
Okay, he said Mind Over Mood. We're kind of wrapping up here. I wanted to mention again real quick that the Regional Behavioral Crisis Line is available 24 hours a day. If you are in crisis, you need help, you can always call that number. It is staffed 24/7. That number is 1-866 567-2400. Real quick, we've just got probably a minute or so to go. What advice do you want to leave people with? And I want to get it from each one of you about depression. Richard, I'm going to start with you on the end. This will be like a debate where you get to go first.
Well, I tell so many people that there's nothing you can't do if you want to do it bad enough. Mm-hmm. And so if someone's depressed, there's lots of sources to go to in this community, you know, and sometimes we're not going to fit with that therapist. So there's plenty of other therapists, but there's solutions out there.
Okay. Jennifer, real quick.
Well, he kind of took mine, but yeah, I was going to say, don't be afraid to ask for help, because there are people out there, and if you may go through 5 or 6 different therapists before you find that one that you can build that relationship with and feel, trust and comfortable talking to. But that's okay. If you have to go through a couple until you find the right fit, that's okay.
Okay. Dr. Yost.
It's insulting, remember, that we have to do something to make ourselves feel better, but we all do. So if you're not feeling good, do something about it.
All right. And we're going to end it right there. I want to thank you all so much for joining us. Be sure to check out our YouTube channel. We'll have this program posted online. Thank you all for participating. Thank you to Sarah Bush for helping us put this program together. And thank you. And we hope to see you every Tuesday at 7 for Being Well.